during the Q&A portion of today's conversation. We'll get started momentarily. We're just going live right now. Hello and welcome, everybody. My name is Jenny Castillo, and I am the Regional Engagement Director for the Southern Economic Advancement Project. We are so happy to again bring to you Pandemic to Prosperity with our amazing folks at NCOC and our partnership with Fair Count. We are so happy to have this conversation and important dialogue about what's happened in the last couple of months with the new changes and the reports out of the South of how we are going closer to prosperity with every moment. We're going to be hearing from a couple of great speakers, including Clarence Wardell from the White House Domestic Policy Council and Alex Kina, Assistant Professor at Virginia Commonwealth University. We will be recording today's meeting and it will be available on Facebook Live. So please make sure to share it with your friends and families so that they can get the most up-to-date information that we have on this report. I would like to take this moment to introduce Dr. Clarence Wardell, who is a senior advisor for policy implementation and delivery working with the White House Domestic Policy Council and across their portfolios of economic mobility and racial justice and equity, as well as a member of the ARP implementation team leading their efforts on data and equitable delivery of ARP programs. Dr. Wardell, please come on stage.
All right, happy to join you on stage, Jenny. So good afternoon, and thank you, Jenny, and thank you as well to SEAP, Fair Count, the National Conference on Citizenship. It's great to be with you all again for the release of such an important report. Denise is now a longtime friend and former colleague, and I had a chance to work with both her and Allison during the transition when I was first made aware of this report and this work, and so it's so great to see it come to fruition. As Jenny mentioned, my name is Clarence Wardell, and I'm the Chief Data and Equitable Delivery Officer for the White House American Rescue Plan Implementation Team and the Senior Advisor to the Domestic Policy Council. It's great to be with you here today, not only because of the great discussion we have ahead of us, but because of the progress we have collectively made over the past 16 months. I know in this moment things feel somewhat uncertain again, but even against that uncertainty, we have made undeniable progress beyond where many thought we would be when President Biden came into office. As we still race to get everyone vaccinated, we're conscious of the work ahead of us to heal the wounds left by the last 16 months to so many of our communities and neighbors. The American Rescue Plan, we believe, is a significant step toward healing those wounds and represents an opportunity like no other that I have seen in my lifetime. As you know, the promise of ARP is not just to build back to where we were before, but to build back better. How we use this opportunity will have multi-generational effects. The actions that communities take in this moment will determine whether the implementation of ARP contributes to reversing the widening disparities across socioeconomic outcomes or further enhances and exacerbates those gaps. The Biden administration is committed to ensuring the former, but we can't do it without you all. Equity and equitable delivery of ARP resources must be front and center if we are to truly build back better. On day one of his administration, President Biden, through executive order on advancing racial equity and support for underserved communities through the federal government, provided a framework and charge for us to do this work. Today, I want to highlight some key pieces of that framework and underscore some of the administration's principles for delivering resources in a way that advances equity. So just to level set a bit, the executive order defines the term equity to mean the consistent and systematic, fair, just, and impartial treatment of all individuals, including those who belong to underserved communities that have been denied such treatment, and then defines underserved communities as referring to populations sharing a particular characteristic, as well as geographic communities that have been systematically denied a full opportunity to participate in aspects of economic, social, and civic life. So at its core, equity means centering those communities, not excluding others, but making sure you're addressing the needs of communities and individuals we have either willfully or unintentionally excluded previously. In that vein, as we look forward to maximizing this historic opportunity, I want to offer a few thoughts on how we can collectively ensure we're centering those most in need at this moment and delivering in ways that are meaningful and transformative. For us, that means two things. One, ensuring that individual programs and initiatives are being delivered and executed in ways that center equity. And two, that beyond the individual program execution, we're thinking more strategically about what those programs and initiatives should be and whether they're aligned with broader equity goals. On that second area of focus, given the wide range of flexible uses of for instance, the state and local funding, as well as several other funding streams, I would encourage us to think about ways in which the pandemic has exacerbated inequities in our communities and to structure a set of packages toward addressing explicit equity goals. What areas are we seeing disparate impact and disproportionate harm from the pandemic that we must address? And that I know we'll talk about a little bit later today. But for instance, we know that we need to address learning loss in a comprehensive way. We know that equal access to quality childcare will be critical to getting parents back into the workplace, and that addressing housing stability for those who are on the precipice will be critical. Offer these as a few examples where concentrating resources to address areas of high disparity will be critical to advancing equitable outcomes. However, as mentioned above, deciding what to invest in is only one piece of the puzzle here. We can't make the investment decision and then walk away. We have to be doubly invested in making sure that those programs and initiatives are delivered well and in ways that are advancing equity. To do that, I offer a few principles that we think about when considering how to deliver equitably. One, design for the hardest to reach and most in need. So center those who are most in need and understand their challenges with accessing programs and services, and design programs to ensure everyone will benefit. Are underserved populations aware your program or service exists? Can the most vulnerable access and use your programs or services without massive amounts of burden? Are we allocating and distributing resources for underserved communities? Number two, we think about accountability to equity through measurement. And so are we setting clear equity goals around our programs and designing our systems to collect the data to understand progress towards them, including allocation flows and who is actually accessing and receiving the resources? Number three, we think about building short cycles of feedback, both using quantitative and qualitative data. So not only are we making sure we're collecting the right data, but we're doing it in ways that allow us to learn as quickly as possible and to course correct. And this is particularly true for new programs. It is even more consequential to understand how they're working. And I can't stress this enough. If we're not centering community voices and taking the time to understand what people need and want, and whether or not what we're offering is meeting those needs, then we're not delivering in an equitable manner. And then the last piece that I would highlight and lift up here is around investing in what works and building evidence where it's missing to ensure that we're investing in things that have a strong evidence base behind them. Or if they don't, making sure that we're creating the evidence and collecting the data along the way through a set of rigorous evaluations. I think we should constantly be evaluating, hopefully setting up some structures to examine outcomes and not just outputs. For instance, if we're thinking about a rental assistance program, we're not just asking if we're getting dollars out the door, but are we actually keeping people in their homes over the long term? Whatever your programs are and whatever the work looks like, actually making them work for everyone is the core of equity work, which means if we are to do it well, we must center those who are most in need to make sure we are reaching them and that they are able to take advantage of the resources. This is the moment when we have, thanks to the American Rescue Plan, the resources to do more than we have ever imagined and to build something that lasts with equity at the center. I look forward to continuing to be close partners with all of you all into the conversation ahead of us today. So thank you, Jenny.
Thank you so much, Clarence. We really appreciate your time here and all your reflections. We thank you for your time, and if you have to log off, we understand that. Now it is my honor and pleasure to introduce to you all Morgan Smith. Morgan Smith is the municipal leader for SEAP's South Strong Cities and their American Rescue Plan Toolkit project. Until recently, she was the city manager for the city of Bainbridge Island in Washington, and previously chief of strategic planning for the city of Atlanta. Morgan, please come on stage.
Hello, and thank you for the chance to talk briefly about our project. We can move to the first slide. SEAP launched our ARP Toolkit project and outreach efforts to help support good ARP spending decisions in the communities where getting it right, we think, can make the most impact. We think good ARP spending hinges first on local governments taking the time for public engagement, and then also making sure that their ARP decision-making process is both accountable and transparent. An overall focus of our work is to help fill capacity gaps in smaller communities where it can be harder to make these investments in good process and in including community voice. Next slide. To help local leaders articulate their shared commitment to a good ARP process, we've developed a model resolution that cities and counties can consider. The model resolution isn't one size fits all, and communities can and should customize it to fit their needs. But the main benefit is to capture and publicize local leaders' commitments to how ARP spending decisions will be made, and also to that critical work around community engagement and transparency. Next slide. Our project approach is threefold. First, we're working with a wide range of local advocates to make sure they understand the opportunity and are ready to engage on ARP decisions. We are also collaborating with national municipal partners to share information about how ARP is unfolding, to elevate good examples of work on the ground, and to identify emerging issues. And finally, we're conducting outreach to local government leaders, both elected officials and managers, so we can encourage this good process and also can learn what help and support they need. Our next steps will include a series of roundtable discussions, and we'll be hosting those with local leaders in key states. We expect those conversations will be helpful as we shape our understanding of what resources are needed next going forward. Next slide. There's a lot at stake for communities and residents during the ARP decision-making process, and nowhere maybe more so than in the Southeast, in which we will see in more detail during today's data discussion. Along with building a more sustainable recovery and more resilient communities, we also think that helping leaders get ARP right can have other downstream benefits. We think a good approach on ARP choices can provide a framework for how leaders will take up future investments like infrastructure spending. And we also think that helping to build a good ARP process now can seed better public engagement going forward, particularly for local governments in places where that isn't yet part of their business as usual. Next slide. We're seeing issues in several areas. First, around awareness, there's still an opportunity to continue to elevate and publicize the significance of these funds at the local level. Capacity is another concern, but keep in mind that local leaders make decisions about how to spend time and resources based on what the community says needs to matter. So this can circle back to awareness, really. In some places, we're seeing less familiarity with public engagement tools and approaches, and also uncertainty about how much engagement is going to matter when they're reporting and tracking their ARP spending. And then in other places, we're also seeing less commitment to equity outcomes as a factor in spending decisions. There is great guidance on this from Treasury for larger communities in the context of their reporting requirements. And so as part of our project, we're thinking about how to carry those equity goals across to smaller governments as well. Next slide. So if you're looking for ways to get involved, be ready, be informed, know that this is happening and why it's important. You can also help to set expectations for your local ARP discussions, expectations about public engagement, transparency, and making data-driven spending choices. And it helps when you can frame the significance of today's decisions in terms of results. What will be different because of this ARP investment? How will the community be better or more resilient? And looking ahead, how and when will you measure those results? Next slide. So there's more to know and more to do, and we are here to help. And here's some information on how you can find out more about our project and tools.
Thank you so much, Morgan. In the chat for our attendees, I have put in some information on how to get to these resources. So please make sure to click on that. We really appreciate your insight, Morgan, and all that you are doing for ARP and with the SEAP team. It's now my pleasure to introduce to you all the co-authors of the Pandemic to Prosperity report. Please come on stage.
Great. Thank you, Jenny. Can you see me?
Yes, we can see you and we can hear you.
Thank you. Well, that was wonderful. Thank you so much to Clarence and to Morgan. The ARP funding is such an amazing opportunity to really increase equity in communities. And we hope that everyone watching is understanding the importance of that and is accessing some of these toolkits, we want to share with you our latest installment of our Pandemic to Prosperity South report, which is a data-rich report that we publish in collaboration with Fair Count and Southern Economic Advancement Project. I'm Allison Plyer, the Chief Demographer of the Data Center in New Orleans. History has shown that crises accelerate pre-existing trends and disparities and permanently change societies and civic life. But such crises often create new opportunities for increasing equity, and an equitable recovery requires data for helping make the case. Next slide, please. Oh, I'm sorry, you're on the right slide. Pandemic to Prosperity is inspired by a report series we published here at the Data Center to track New Orleans post-Katrina recovery. We published the New Orleans Index on a regular basis so that everyone had access to a shared base of information that tracked rapidly changing conditions and helped to identify inequities in the recovery so that they could be mitigated. This slide shows all the indicators in this month's edition of Pandemic to Prosperity, and we've highlighted the specific data we're going to review today in this webinar. But do check out the whole report when you get a chance. It's in the top right, you can see the web address, pandemictoprosperity.org. This report measures how COVID has affected lives and livelihoods, but we also track indicators that will be important for recovery, such as high functioning governments and civic institutions, and most importantly, metrics that assess how people are doing during the pandemic across geography, race, and gender. Denise?
Thanks, Allison. I'm Denise Ross. I'm a senior fellow at the National Conference on Citizenship, and Allison and I worked together for many years tracking New Orleans recovery after Katrina. The national COVID case rate is now about 1/10 that of the high point earlier this year, so that's good news. On this map, any county that's shaded orange or red is a hotspot in danger of rapid doubling of cases, which you've probably seen happening in some communities. Early hotspots in the Northeast are now low. They're shaded in light blue or yellow, and high rates really are peppering the South, which has some of the nation's lowest rates of vaccination. Half of the 10 states with the highest cases are currently in the South. That's Arkansas, Florida, Louisiana, Alabama, and Mississippi. Complicating the public health response to COVID is what the US Surgeon General recently described as the urgent threat posed by health misinformation. In May, a survey found that 2/3 of unvaccinated adults believed in COVID myths, such as the vaccination causing infertility or changing one's DNA. Civic infrastructure, such as healthcare clinics, local news stations, schools, and community groups have an essential role in sharing accurate information on COVID and building resilience, community resilience to misinformation. State reporting on case rates and hospitalizations and deaths and genetic variants is critical for tackling this crisis with our eyes wide open. However, in recent weeks, our colleagues at Johns Hopkins Coronavirus Resource Center noticed a troubling trend that states are starting to publish data less frequently. So what you see on this graph along the bottom is the percentage of people vaccinated in each state. Any state to the left of that middle line has less than half of its residents vaccinated. On the y-axis going up is how many days a week the state is reporting COVID case numbers. You can see that all the southern states, except for Virginia, are in the danger zone. That means that they are less than half vaxxed and are reporting data less frequently, and therefore risk hospital systems and communities being unprepared for surges, that rapid doubling that we talked about. It's worth noting that the state reporting only 1 day a week, which is Florida, at the bottom of the graph, currently accounts for 20% of the nation's COVID cases. Now, I know that some states have argued that they still have internal dashboards, which are updated more frequently, but that assumes incorrectly that government's the only actor here. The pandemic is an all hands on deck endeavor, and patchy public data makes it harder for community-based outreach efforts to make mid-course corrections and for local media to report on what's happening. Allison will cover job losses next.
Great, thank you. Next slide. This map shows loss of jobs since February 2020, just before the pandemic. And the darker shades of blue indicate greatest decreases in jobs. So across the South, nearly 1.4 million jobs have disappeared since COVID struck. Louisiana, in the darkest blue, was hit the hardest, with jobs down nearly 8%. Despite recent job gains in 2021, the nation is still down 6.8 million jobs compared to pre-COVID. and women have lost 27% more jobs than men. Next slide, please. The chart shows the rate at which workers quit their jobs, which hit its highest level on record in April, as you can see in the dark black line. The quits rate has been particularly high in leisure and hospitality, where wages are low and churn has always been high. But high quit rates are taking place across every sector, including professional and business services. All total, 18 million workers have quit their jobs just this year. The pandemic caused workers to rethink their options, with some upskilling to move to higher paying occupations, many retiring early, and 1 in 4 full-time workers indicating they plan to look for a new job this year. Generally speaking, workers are demanding higher wages and better working conditions, including flexibility and remote work. While rising wages are badly needed in our economy, childcare centers are struggling to compete for workers now, and shortages in childcare employees are creating a domino effect, hindering many parents' ability to return to work.
This indicator is near and dear to my heart, as I still recall the patchwork quilt of childcare that I had to arrange after Katrina, and how often it fell through. We're seeing similar brittleness in the childcare sector right now. Although much of our society is reopening, childcare disruptions have not improved, represented by a flat line over the last 3 months, where 1 in 10 adults have experienced a childcare disruption in the last 4 weeks. This leaves families in a lurch. In just the month of June, more than 1.5 million parents cut their work hours to care for children. 1.2 million parents took unpaid leave to care for children, and nearly 1 million left the job. 500,000 lost a job, and 1 million did not look for a job because of childcare disruptions. All of which mean reduced income that can cause a family to skip a rent payment, delay seeking needed health care, and struggle to put food on the table. These are all indicators that we cover in the report. In Louisiana, where the pandemic caused an estimated $245 million in losses for the childcare sector, policymakers and childcare leaders are actively discussing how to best use incoming American Rescue Plan dollars to shore up a fundamentally unstable sector, where parents often can't afford tuition, educators can't afford to live on the low salaries, and centers can't break even. So an opportunity here for advocacy is to leverage these one-time investments into long-term investment in early childhood education.
This map shows in gray the counties where unemployed workers who receive only state unemployment benefits can actually afford the cost of living, which turns out to be nowhere in the South, with the exception of Kentucky. Even with the additional $300 weekly federal unemployment benefit, these benefits are very low. For example, in Louisiana, the maximum state unemployment benefit with the federal supplement is $527 a week. That's the equivalent of a little bit less than $14 an hour. But average babysitter rates are over $14 an hour. Employers who don't provide wages above $14 an hour are going to be hard pressed to attract many workers who could make more money babysitting. And without affordable childcare and after school care, many parents can't afford to return to work, as Denise just explained. Yet on this map, you'll see X's on the 9 southern states that are eliminating the $300 federal benefit well before many schools even reopen. This line graph shows monthly poverty rates by age group since the pandemic struck. The top darkest blue line is for children. The middle line is the elderly, who you can see have had pretty stable poverty rates during the pandemic. And you might wonder why. Well, you probably know that poverty among the elderly has been a national focus since the Great Depression in the 30s, when Social Security was enacted. And Social Security has been very successful at stabilizing the financial well-being of the elderly. Now, if you look at the pie chart at the bottom right corner, you'll see that the American elderly are disproportionately white. Notably, from the onset, Social Security excluded domestic and agricultural workers, many of whom were Black at that time, and today many of whom are Hispanic. Thus, Social Security is not available to all elderly in the US. Now, the line chart also shows several points during the pandemic when child poverty, that top dark blue line, dipped quite a bit. Every year at tax time, there's 2 kinds of tax credits that significantly reduce poverty thresholds. They're the earned income tax credit and the child tax credit, which you can see on this chart. And there's different places on the chart marked where you can see how stimulus checks and expanded unemployment benefits helped to reduce poverty during the pandemic, but did not entirely blunt it. This year's American Rescue Plan includes new expanded child tax credits, which we haven't mentioned yet today in presentation, but it's very important. The vast majority of families with children will be receiving monthly checks, monthly payments in their bank accounts from July through December this year. The communities can reach out to the most marginalized families to ensure that they sign up for this tax credit to help lift them out of poverty and improve their overall well-being.
As we enter the next phase of this COVID crisis, we need to prepare for the aftershocks. These three aftershocks are of particular concern. That's the effects of 1, delayed medical and mental health care, 2, housing instability, and 3, disengaged young people. We're going to dive more deeply into these issues with an eye toward how we can use the American Rescue Plan funding to head off these secondary disasters. On delayed healthcare, last month, more than 15% of Americans reported delays in medical care due to the pandemic. And 1 in 10 Americans who needed mental health care were not able to get it. Outcomes of this delayed care may be particularly devastating for women in poor health, almost half of whom have skipped recommended tests or treatments during the last year. Children are also particularly at risk, with many having missed routine vaccinations. Also, difficulty accessing mental health care is taking a toll, with drug overdose deaths up by nearly 30% in 2020 from the year prior. Healthcare facilities can't just continue with business as usual with this wave of need coming down the pike. There's a lot of preventative care to catch up on, and underlying health disparities continue to wreak havoc on communities of color. Communities will want to think creatively about how to best use the surge of recovery dollars to put in place durable solutions.
Since 2010, rates of uninsured adults across the US have dramatically dropped, as you can see year by year. And this happened because of the implementation of the Affordable Care Act. Still, Hispanic, American Indian, Pacific Islander, and African American populations had higher rates of uninsured adults, as you can see in the upper 4 lines in this chart. In 2019, just before the pandemic, 1 in 4 Hispanic and American Indian adults were without health insurance. Thus, racial and ethnic groups who had the highest exposure to COVID were even more vulnerable because of the lack of health insurance. Across the South, 16% of working age Southerners lacked health insurance, lacked it before the pandemic, compared to only 11% in the rest of the US. Now, marked with an X on this map are the 7 Southern states that have not adopted Medicaid expansion, which is a main reason for this North-South difference in health insurance coverage. Counties with particularly high rates of uninsurance are brown and orange on this map, and 2/3 of these counties are rural. The implication of not expanding Medicaid is particularly hard on rural communities. Without Medicaid expansion, rural hospitals don't get enough reimbursement for the care they provide, and many of them eventually close. In the last decade, from 2011 to 2017, rural hospitals most likely to close were in the South. When rural hospitals close, ambulance rides to remaining hospitals are longer, and ambulances start serving as de facto emergency rooms. During COVID, many rural residents were unable to get tested for COVID and then delayed getting care. One study found that in rural counties where a hospital had closed in 2020, COVID health death rates were 39% higher than in their state overall. In addition, when rural hospitals close, that's a key job center and it's lost. And it makes it hard to attract more residents, makes it hard to attract additional businesses, and it contributes to a downward spiral for many rural communities. These data that we're showing you today can be used to help advocate for Medicaid expansion in your state, particularly given the $15 billion in American Rescue Plan funding to incentivize states to expand Medicaid. Another aftershock we anticipate will be housing. In Florida, in dark orange here, more than 60% of adults who are late on their rent or mortgage figured they're likely to be evicted or foreclosed upon in the next 2 months, with eviction being the more proximal threat. Florida may have some of the harshest eviction laws in the country. And the CDC moratorium on evictions is effective only until July 31st. That's just 3 days from now. Also, the accumulated rents due on July 31st could be enormous. The federal stimulus and recovery bills include a combined $45 billion in rental assistance, but this assistance is being doled out through hundreds of local programs that are dispersing the funding very slowly, with only 13% expended so far. Communities can take 2 actions to stem an impending tide of homelessness. One, enact programs that provide direct-to-tenant payments and simpler paperwork to help these funds move more quickly. Two, pass one or more ordinances that hold landlords accountable for unjust evictions and stop eviction processes when past due rent is paid. As Morgan mentioned earlier, SEAP provides these eviction ordinances in their grab-and-go policy toolkit.
One of the most basic metrics for how students are faring in this pandemic is whether they are attending classes. There's a lot going on with these data, so I want to pull back the layers a little bit. In this graph, we focus on the non-attendance rate. Generally, that represents percent of students who are enrolled but don't show up on a typical day. These are the remote-only 8th graders, and there's been a lot of variation in how states and school districts track attendance for online students. So even with all these caveats, the data are concerning. The black dotted line represents non-attendance of all 8th graders in remote learning. The blue bars represent data for the most vulnerable students. Dark blue is those who are economically disadvantaged, medium blue is English language learners, and light blue is children with disabilities. Students in at least one of these vulnerable groups in Alabama, Arkansas, Georgia, and North Carolina have non-attendance rates 5 or more percentage points higher than the total population of 8th graders in their states. Some disparities are far greater, such as Arkansas and North Carolina's children with disabilities. Finally, let's look at the data that are missing. 8 southern states with the red arrows here did not meet reporting standards or declined to share data for one or more vulnerable student populations. And even for states reporting data, quality varies widely. For example, Florida is the only state in the South with no statewide attendance policies or data reporting standards on attendance. So it's harder to have a lot of confidence in these numbers for some states. Additionally, attendance data like this misses all of the students who are currently not enrolled at all during the pandemic. So as you look at the recovery dollars coming into your community, these data suggest 2 lines of action. One is to invest in a surge of wraparound resources to help those disengaged students and their families get back on track for the fall. And secondly, to carve out funds to improve data quality and reporting so we can see where students need the most support and whether interventions are helping.
This slide looks at civil unrest. Over 1,700 protests have taken place across the South in this year, 2021. And while violent protests command all the media attention, 99% of the protests have been peaceful. Most recently, from April through June, nearly 300 demonstrations advocated for criminal justice reforms and in support of Black Lives Matter. Nearly 100 protests were in support of worker rights for miners, janitors, fast food workers, and increasing the minimum wage overall. Southerners are increasingly concerned about gun violence and participated in nearly 100 demonstrations about gun violence. Southerners also participated in 53 protests against new restrictive election laws and anti-rioting laws, as well as 52 protests in support of LGBTQ rights. About 40 demonstrations took place demanding greater investments in community needs, such as affordable housing and mental health services, and against evictions and cuts to higher ed. Roughly equal numbers of protests, about 14 each, took place in support of and against the teaching of what has been called critical race theory, but more accurately is the history and current impact of white supremacy in America. Since January, only 1 protest against perceived election fraud took place in the South. Now I'm going to turn it over to Taylor to talk about redistricting.
Thanks so much, Allison. Hi, everyone. My name is Taylor Sable. I'm a policy and research analyst at the National Conference on Citizenship, where much of my work focuses on 2020 census issues. The 2020 census experienced extreme headwinds. The pandemic, natural disasters, and intense politicization delayed the release of this decade's redistricting data, which will now be delivered by August 16th. While necessary, the delay does create challenges for many states, which under normal circumstances would have almost 4 more months for the redistricting process. To adjust, states are turning to a number of remedies, such as court extensions and calling for special legislative sessions. What this graph shows is the amount of time that each southern state has for drawing state legislative and congressional maps once the redistricting data are released next month. The yellow dots show state legislative districting, and the dark blue dots show congressional districting. States with a green dot, like Kentucky or Georgia, have the same deadline for both state legislative and congressional maps. What we can see is that each state varies in the amount of time it will have to redraw their maps. Alabama has a state deadline for legislative redistricting that's already passed, and they'll need to adjust. But every other Southern state has at least 3 months to draw their state legislative districts. Southern states have between 4 and 11 months for their congressional districts. As states seek to work within their compressed timeline, it's important that lawmakers aren't tempted to skip transparency and public input. Communities should be ready for robust engagement, and timing adjustments should not be a reason for lawmakers to dispense with public participation. Southern states have sufficient time to engage the public for fair and transparent redrawing of voting districts. Professor Alex Kina will talk more about this next.
Hi, how's it going? I'm Alex Kina. I'm a assistant professor at Virginia Commonwealth University. And I'm going to talk a little bit about redistricting that's coming up, to pick up where Taylor left off, and about what to expect and how the public might be able to influence the process. Next slide, if you don't mind switching slides. So this is the results of 2020 apportionment, the long-awaited results. And no surprise, the South is growing fast in many states. Many Southern states are growing faster than the national average. And so with the exception of West Virginia, no state in the South lost congressional districts this decade. And in fact, North Carolina and Florida are actually gaining seats. Next slide, please. So this is such an important question. And I think more and more people recognize how important redistricting is, especially in the last 10 years. But the critical question is who's actually drawing the lines, because this determines what sort of outcomes will result as a result of redistricting. And across the entire South, the GOP, the Republican Party, controls every single state legislature and governorship, except in Kentucky and Louisiana, where Democratic governors are seated and will have a veto over redistricting, and in Virginia, where there's actually the legislature does not necessarily draw the maps. Next slide. So how exactly will the lines be drawn? We know that the Republican Party controls redistricting this cycle. They also happen to control redistricting in most states during the last cycle. And what actually happened? Well, my research with McGann et al. In 2016 showed that at the congressional level of congressional districting, in every single congressional map, there was a Republican bias. I just want to be clear that I'm not a member of a political party. I don't have a partisan agenda here. I'm just reporting the data that we have in our analysis of redistricting. And what that means is that the Republicans in all of these southern states had an advantage. If the vote were split, for example, 50% Democratic, 50% Republican, the Republicans would gain substantially more seats in Congress than the Democrats would. And so it's essentially rigging the map so that Republicans win with a lopsided margin. Now, recently we just published a book that looked at state legislative districting that's much more complicated, particularly when you think about the variation in state legislatures and how they district. West Virginia has multiple districts, multi-member districts, for example. Well, we spent a couple of years putting this together, and we found similar patterns in the southern state legislatures. The GOP very clearly gerrymandered almost every single southern state legislative map, with a few exceptions. Next slide, please. So the question for us to understand is how exactly did the Republican Party gerrymander? And what our research is starting to make clear, that probably a lot of folks understand already, is that because of the way that people are geographically distributed in a number of southern states, it makes it very easy for Republicans to gain an advantage. And what they end up doing, and we found pretty compelling evidence, is that they're essentially looking for communities of color, and they are packing communities of color into a small number of districts, ostensibly to advance requirements of the Voting Rights Act. So the Voting Rights Act requires state governments to draw majority minority districts when there are large, geographically condensed populations of minority voters. So what that means is, it's an expansion of minority representation, and it's a very good thing. And the Voting Rights Act has dramatically increased the number of state legislative and congressional districts that elect Black representatives or Latinx representatives, for example. But what's happened, at least in the last 10 years, is that the GOP has been using this requirement to draw majority minority districts in a way to hurt Democrats. And what they end up doing is packing Black voters into districts at margins that are far greater than you would need to advance the goal of simply electing Black representatives. And without going into too much detail, this is some data, some graphs from our book that shows the relationship between racial segregation on the x-axis down there and the amount of gerrymandering. So negative figures means gerrymandering in favor of Republicans. And what we see is that when the maps are drawn by the Republican Party, when they were drawn by the Republican Party, greater racial segregation at the state level led to dramatically more in Republican gerrymandering. But that's not the case with maps that were not drawn by the Republican Party. Somehow, states that had high levels of racial segregation managed to draw fair maps in spite of this segregation when they were not drawn by the Republican Party. So that seems to be the key variable here, is that when Republicans happen to control redistricting, they seem to be exploiting the natural, I don't want to say natural, the geographic racial segregation as a way to gain a partisan advantage. Now, I say this is probably no surprise, because this is like a duh thing for everybody who's listening, but this is pretty compelling scientific evidence that we have that would suggest that this is the tactic. And in fact, we saw this was the case in at least Alabama, North Carolina, Texas, and Virginia, where federal courts struck down and ordered revisions to maps that were drawn by the state. Next slide. So what can regular citizens do about this? Well, there are a number of southern states that have the public playing a role in redistricting, at least on the sidelines. Earlier this month, as many of you know, Georgia held public hearings, and Mississippi is planning to conduct 9 public hearings to be live streamed next month for redistricting. I include Texas on here. Texas isn't considered part of this analysis, but Texas also has an interesting way for citizens to be involved. And in Virginia, where we just passed redistricting reform, there are a number of ways for the public to participate in the process. There's a public comment period, and all of the redistricting commission's meetings are public and live streamed. Next slide. But there are some other methods. The remaining states, I wasn't able to find any evidence that there are public meetings being held for redistricting, but there's a number of other things you can do, even though the public seems to be completely out of the loop in all of the other southern states, and the public seemingly has no formal role. We learned a lot of lessons from the last redistricting cycle, and that is when the public gets involved in redistricting, when the public learns about how to map and draw districts and educates itself, then lawmakers end up paying attention. One of the ways that you can actually participate is by drawing maps for your own state. The more maps that we have made for southern states that are fair and treat parties neutrally and advance minority representation, this actually is ammunition that we can use in future litigation as evidence for the fact that there are fair maps that can be drawn. Because what politicians who draw these maps end up doing is they go to court when the maps are challenged and they said, hey, we were just following the law. We needed to draw the maps this way in order to comply with the law. Well, if there's an alternative map that they had access to that was fair and achieved all of these different criteria, then that's evidence for intent, and that can be very, very helpful. There's also a number of states across the country, only 2 in the South, that define communities of interest as a redistricting criteria. Unfortunately, most of the states in the South don't really have anything to say about how the districts should be drawn. Nevertheless, you can still go to an interesting website that's run by Princeton called Representable and define what a community of interest is in your state. And that might be helpful down the road, particularly when you think about litigation. There's also a really informative website all about redistricting that's published by Loyola Law School that has all the information you could possibly need to know about how to redistrict. I have one more slide, if you don't mind switching slides. And that is some lessons that we can take for achieving reform. And in Virginia, we had an extraordinarily successful campaign to end political districting that took years and years and years, but it's really remarkable given how hard it is to actually change the Virginia Constitution. In a lot of Western states, there's the direct democracy, and it's a lot easier to change the Constitution. But in the South, we don't always have that option. And in Virginia, the process of changing the Constitution was really, really hard. But ultimately, what happened is it started off over several years, nonpartisan organizations basically engaging with the public, mobilizing the public, educating citizens, and working with really, really, really powerful organizations like Common Cause and League of Women Voters that were really helpful at mobilizing support for gerrymandering reform, and it worked. And one of the key lessons here is that we need both Republicans and Democrats to be on board. This is not simply about Republicans or Democrats. It's about creating a coalition to gain support. And so it may seem impossible. I remember 10 years ago in Virginia, it seemed impossible to ever think that the state would adopt constitutional redistricting reform, but it worked. And there are a lot of important lessons we can learn from Virginia. But I think I'm out of time, so I will cede the rest of my presentation.
Thank you so much, Alex. We really appreciate your insight. And I've dropped in the chat some of the websites that you've mentioned so that folks are able to visit those. Now we would like to welcome on the stage Dr. Janine Abrams-McLean, who is the Vice President at Fair Count. And we just wanted to check in with you. One second, Janine, not yet. Hold on. This slide got me all messed up. We're actually going to be doing Q&A now. So Janine, sit tight, but we are
that was my bad.
Certainly, it's going to be okay. I make things work for us. We are going to go into the Q&A session just now and would like to welcome our panelists on stage for some questions here. And one of the first questions would be to ask you all, and maybe we can just have Morgan talk about this, but what can we do to make these data more relevant at the local level?
That's a great question. I can think of multiple ways that the themes and data we just saw can and should be part of ARP decision-making. Maybe Denise or Jenny, if you could pull up the outline we have for our toolkit piece, how to tell your recovery story. I think that might help to look at because we built this to give a high-level outline about how we'd like decision makers to shape their ARP spending conversations, and there's a lot of ways to connect data inside of this. So we built this piece to help map out an approach for both leaders and advocates to talk together about ARP's significance, what their pandemic impacts actually were, and how to connect the dots between ARP spending and community needs. So the goal of this guide, and this is just, obviously the high level, but the goal is to help kickstart those conversations and provide a jumping off point for telling your community's recovery story, and also importantly, building community voice into ARP spending. So thinking about data, whether you're using data to frame the opportunity, to discuss needs and outcomes in a more tactical way, or if you're talking about specifics of pandemic impacts and the effects on your community or state, and even looking ahead to measuring results. the use of the data like we saw today at the local level can really support better decision making throughout that dialogue at really almost every layer. I also think, just want to put in a plug, I think using data in that way can really help with engagement as well, because it works to flesh out the storytelling component and establishes a shared perspective on what's happened and where things stand and how you're hoping to move forward.
Thanks, Morgan. And I think that's also a good way to frame up the comment in the chat about how will we address this and frame this information for our broader, more conservative public. I think this is a really great way to get that information out. We also would like to encourage y'all who are on the live and are seeing the questions come in, that you can get more information on our website, theseap.org, or southstrong.org to get more information in the toolkit for the South Strong cities. I have a question here from Roxanne. I'm here in Georgia. How does the fact that more than half of childcare centers closed in Georgia within months of the pandemic affect women and underemployment during the pandemic? Would anybody like to answer that question?
Allison, do you want to take that one?
Sure. Yeah, sure. Yeah, I mean, as Denise showed in some of the data, at least at the national level, we know that one of the main reasons that parents in general have struggled to, have lost jobs, women in particular have lost jobs, and then have struggled to have the time to go to look for a job, or have had to quit a job, or have taken less hours, et cetera, is because of lack of childcare. That's why women have lost more jobs than men overall, why they've cut hours. And this is across the income spectrum, right? So whether they're lower wage workers or they're professional women, have had trouble advancing in their careers, because I think everybody knows that, when we have children at home, we have to spend our time watching over those children, right? So in the report, we show different employment rates by men and women. So you can look at that and see that employment rates for women have been much lower since the pandemic. And there's just a myriad of ways that the lack of childcare has really hindered women's ability to work during the pandemic. And if we don't invest in childcare going forward and make sure that it is affordable and available, there are a lot of women who will not be able to rejoin the workforce. And that's going to hurt employers across the spectrum. So, when we think about places like Europe, where childcare is available broadly, a lot of what has been proposed for investments in childcare here is nothing radical. It's just what makes it possible for more women to be in the workforce and advancing in their careers in other advanced countries.
Yeah, I'll add quickly. One challenge with the childcare sector and the American Rescue Plans coming in is that it's not really a system. It's a bunch of independent operators. So it's very hard to understand the best way to distribute the dollars to have the greatest impact. So it's different than the K-12 educational system, which has some structures that can be put into play to deliver these resources. So it'll require some creativity, and some real commitment to make sure that those dollars flow where they're most needed.
Thank you so much, Denise and Allison. I have one question for Alex. What was that other website that you must mention so that folks can get more information?
Let's see. I'll type it here. I think it is representable.org. Is that right?
I think that's what you said.
I'll try that. I think that might be what it is.
All right, I'm gonna put it in the panelists and attendees. So folks,
yeah, I see.
No problem.
I'm gonna type it in right now, representable.org. And it's an initiative headed by Princeton University. And the idea is that we don't really know what communities of interest are. They're in the constitutions of a number of states that redistricting authorities have to draw districts in a way to empower communities of interest. But what does that actually mean? So many times this ends up getting settled by a judge, and a judge doesn't really have standards. So it's an attempt to sort of draw communities of interest ourselves, to harness the power of the crowd to draw, to delineate these communities of interest. And so the more people who participate, the more effective and sound the data is.
Thank you so much, Alex. And thank you to Denise, Allison, Taylor, Morgan, and Clarence for your insight on today's Pandemic to Prosperity South. It's now my pleasure to introduce Janine Abrams McLean, who will talk to us a little bit about what's going on with Fair Count as they are also moving into the redistricting work, and to close us out. For any information that you all received here, you have registered. You will be getting an email with some follow-up information and some of these websites as well. Janine, thank you for joining us.
Thank you, Jenny. And thank you to all of our speakers and our attendees for joining us today. Just on the redistricting side, I do want to invite everyone to, I'll put it in the chat, but Fair Count is one of 9 organizations that's involved in a national community engagement hub for redistricting called Charge. And so I'll put that in if you want to learn more, if you want to get trained, if you want to learn how to testify, if you want to keep up or just learn about how communities can get engaged in the redistricting process, then please go to the Charge website. But for what we're talking about today, our recovery is in a precarious position. Attention, resources, and representation will be needed to shepherd it into an equitable end that sees the communities hardest hit by COVID-19 come back stronger than before. To ensure an equitable recovery, Southern states must invest in data infrastructure, including bolstering systems that track the delivery of public assistance benefits and measure the effectiveness of programs. Civic engagement will be more important than ever to ensure federal dollars are used to the greatest impact and that communities have fair political representation. As you heard today, state and local governments are receiving unprecedented federal funding through the American Recovery Plan that can help address economic, health, and social challenges. The ability of these funds to make a real impact will depend on effective and equitable community engagement. Moreover, whether Southern communities get the attention, resources, and representation they so desperately need will strongly depend upon redistricting. So it's critical that the people, us, all of us, get involved and demand fair districts. And fighting for equity means speaking up at public redistricting events, drawing and submitting community maps through programs like Representable, and staying informed about what our leaders are doing to our maps, our government, and ultimately our votes. The recovery successes we've seen today can be built upon, and the failures that we've seen can be mitigated or reversed. But it's going to take our attention, our resources, and most importantly, our representation. And those are going to take action from all of us that are on this call and all of us in the communities that we live in. We have the data, the numbers, and definitely the motivation to fight for an equitable recovery. Together, we can move from pandemic to prosperity. So once again, I just want to thank everyone for being here today, and I will turn it back over to Jenny to close us out.
Thanks so much, Janine. Incredible. Again, thank you to all of our speakers, to Janine, to Alex, Kina, to Morgan Smith, to Allison Pryor, Denise Ross and Taylor, and to Clarence Wardell for joining us earlier. We welcome you to keep visiting our websites and to make sure that you're getting all the information. We will be sending out a follow-up email from this. Thank you to all those that are watching us on Facebook, and whoever would like to see this recording, it will be available on our Facebook page, SEAP South, and you will also be getting a link to the recording on our email list. Thank you all again so much for everything and for your time, and we wish you well. And this is Pandemic to Prosperity South. We'll see you all next time. Thank you.